Hey, so for my speech, we're going to talk about what should be done in terms of suicide prevention. First, we need to start off by talking about how when someone is going through a hard time and someone else notices in terms of suicide, the first thing they need to do is identify the situation, the person, and what's going on with them. They need to know what's wrong with them. They need to know what's bothering them, and most people won't open up right away, but if you can get some type of information about the person and their situation, then that should help. Next, you should approach someone for help. If somebody comes to you and they're going through a hard time, or they tell you that something is really bothering them and they don't know what to do about it, or if they even mentioned suicide, that's when you approach somebody else for help. Next, you want to just go ahead and research suicide prevention. There are plenty of websites out there and plenty of suicide hotlines that people can call, or just so many different resources people can look at in terms of suicide prevention and what they need to do for that loved one they're worried about. They need to look into what needs to be done for that person, so as soon as they start researching, they need to look at the next steps, like after they identify what's wrong or after they identify that that person needs help, they can go ahead and make the next step by looking into it. After researching and looking into the situation, that person will then need to set up some type of intervention for this person. An intervention normally is when a group of professionals or some close family members will gather around in a personal environment like a home or some type of meeting area, and they will kind of intervene and kind of lend a hand out to that person and tell them that they need help. And then they will then be sympathetic and they will be encouraging